Lower left abdominal pain relief, natural remedies and lifestyle adjustments.
Hello there. Today, we're going to discuss a topic that's particularly relevant to many women: lower left abdominal pain and how we can potentially alleviate it with some home remedies and lifestyle changes. Please remember that these remedies should not replace professional medical advice, and you should always consult with a healthcare provider if you are experiencing persistent or severe abdominal pain.
What could be causing my pain?
Firstly, let's identify some of the potential causes of lower left abdominal pain in females. These could range from digestive issues like gas or constipation to gynecological conditions like endometriosis or ovarian cysts. Identifying the potential cause is crucial because it helps you determine the most effective way to manage your symptoms.
What dietary changes can I make?
Let's start with dietary changes that can help. 1. Hydrate. Make sure you're drinking enough water throughout the day to help your digestive system function more effectively and prevent constipation. 2. Eat fiber-rich foods. Consuming enough fiber can also help to alleviate digestive issues that might be causing your pain. Foods high in fiber include fruits, vegetables, whole grains, and legumes. 3. Avoid trigger foods. Some foods can exacerbate digestive problems and inflammation. These might include processed foods, high-fat foods, and those with high sugar content.
What physical activities could help?
Exercise can be very beneficial for relieving abdominal pain. It helps to improve digestion, reduce stress, and alleviate pain. 1. Light exercise. Regular low-impact activities like walking or yoga can help to stimulate digestion and reduce tension. 2. Stretching. Specific stretches targeting the abdominal and pelvic area can also be helpful. However, if the pain increases with physical activity, stop and consult with your doctor.
Can mindfulness techniques make a difference?
Yes, they can. Techniques such as deep breathing, meditation, or guided imagery can help to manage stress, which is often a contributor to abdominal pain. In conclusion, while these home remedies and lifestyle changes can help to alleviate lower left abdominal pain, they should not replace a visit to your healthcare provider, especially if the pain is severe or persistent. We hope this video has been informative and helpful in guiding you towards some potential strategies for managing your symptoms. Stay healthy and remember to take care of yourself.